This grant focuses on children's cardiovascular health, in particular congenital heart disease. Congenital heart disease is one of the most common birth defects. The incidence of congenital heart disease is about 1 in 100 individuals born. It is one of the most common birth defects, and certainly a birth defect that's associated with a very high morbidity and mortality. We want to answer the question, why are children born with congenital heart disease? And we do that by applying big data science principles and precision medicine principles to answer the question of what causes congenital heart disease.
We know that there are genetic causes of congenital heart disease, but those only account for, maybe up to 50% of the causes. Our hypothesis for this project is that it's really the uterine environment, and in particular, the placenta. We will have two groups of women, one group of women who have the diagnosis of fetal congenital heart disease, and one group of women who have had an ultrasound which shows normal development for their baby. We'll then do a blood draw at 22 to 24 weeks and do a number of genomic studies on that blood draw to see if there are things we can detect that early in pregnancy which have to do with the placenta and thus the development of congenital heart disease.
One area we've been focused on for quite some time for congenital heart disease is understanding how to use whole genome sequences to identify the genetic causes of congenital heart disease. The other area is very much in tune with what people call big data today, which is looking at our electronic medical health records and trying to relate that data over multiple generations of families' hospital records to congenital heart disease, with the idea that that's going to help us both discover new genetic causes of congenital heart disease and also to understand the role of demographics. Those are really, we think, novel and very interesting new avenues for discovery.
This project really is looking at the family and how what we do actually impacts the parents and the family of these affected children, with the hope that we can improve the experience for them as well. We often have to give them these very complex diagnoses where we're talking about a lot of risk in terms of survival or in terms of things that can happen to their child after they're born.
And so my research experience is trying to figure out how do you communicate information to people at some of the worst times in their lives. So our goal in this project was to try to help educate parents so that they can make the decisions that are best for their child and for their family and support them in that decision-making process.